All right, welcome back into Erie News Now Sunrise, 6:24 on this Friday morning. Our Mental Health Week coverage continues. Mental health awareness has been our focus all week long, and with that in mind, our special guest right now is the Hammond Health Foundation's Boo Haggerty. Boo, thanks so much for stopping by this morning and lending us some of your expertise and experience, not just with the Hammond Health Foundation. You're a board member for Safe Harbor, who helps people
Correct.
with a lot of mental health issues here at home. So can you talk about what you are seeing in both of those roles in terms of the need and really the demand for mental health services here in 2023.
Absolutely. And Mark, thanks for having me on. And all of our condolences are with the Erie News Now team. I mean, it's been just a crazy couple of weeks for you and for everybody. But sadly, this is something that is seen every day through the emergency room of the hospital or mostly at Safe Harbor Behavioral Health, where people are in crisis. And I think that's the key word right now. Outpatient behavioral health services are available to the community. We're going to give you some numbers today, but if you actually Google the word crisis Erie, PA, every resource you need is going to come right up for anyone who's in that moment of time that they need help. And the help can be a counselor, the help can be a phone call, someone on the other line. Our crisis center on West 12th Street at Safe Harbor will do outreach. If someone calls and they need someone to come to them in that moment, they can. If they need a 5-day stay in our residential unit just to decompress, they can. And the services are everything from anxiety to depression to alcohol and drug abuse to bipolar, schizophrenia. All those diagnoses are handled by 200 experts who work at Safe Harbor, who work with folks every day to help them in need.
And sometimes the biggest challenge, though, is getting folks in need to take that step and to reach out and make that contact. But you're trying to make it as easy as possible.
And that's where we appreciate you and the fact that you're giving some airtime to this, especially this time of year when people, the message to everybody out there who is suffering is you're not alone. And in that moment, people can feel very alone, and all kinds of things can happen. But calling 988 and getting to that crisis line or calling the crisis numbers that we'll put on, you can have in 17 seconds a person on the other end ready to talk to you. 17 seconds is the longest we wait. That phone is answered in one ring, and you've got someone to talk to in that moment, and it works.
Yeah, it could potentially change somebody from making that decision that you just cannot take back. Boo Haggerty, we're going to continue this conversation coming up in the next half hour. We're going to talk a little bit more about those in-person services that are available if you're going to be reaching out to that 988 crisis hotline. Our mental health coverage, again, continuing all morning long here on Erie News Now Sunrise. We're coming right back after this quick break.